Hello, and welcome to Anxiety Screencast Part 2. Some signs and symptoms of anxiety: feeling nervous, restless, or tense, having a sense of impending doom, that would be like worst case scenario thinking, increased heart rate, hyperventilating or rapid breathing, sweating, trembling or shaking, feeling weak or tired, trouble concentrating, or thinking about anything else other than the worry that's going on inside of your mind, trouble sleeping, GI problems, stomach problems, having difficulty controlling the worry, and avoiding things that are you think are going to trigger the anxiety, which makes sense, but you don't want to avoid situations that are going to interfere with you living a normal life. If you start to notice these signs and symptoms in yourself, then that may be a good indication that it's time to reach out for professional help. Relaxation techniques, some of these are similar, and any of the ones that we talked about in the stress management screencast can work. These are a little bit more specific to anxiety in general. Recognize your anxious thoughts. It doesn't have to be something that you think, oh, I'm feeling an anxious thought, I need to avoid it. Try to think, okay, I recognize the fact that I'm anxious about this. What can I do to redirect my attention to help ease that anxiety? That takes a lot of practice, and that's not by any means something that's easy to do. And maybe that's when talking to somebody about your anxiety, they can give you some more specific tricks in order to be able to do that. Again, don't just say, oh no, I don't want to have anxiety. I don't want to be anxious. I'm just going to ignore this thought altogether, because that's not ever what happens. You have to address it, and you have to recognize the fact that you are anxious about something and then try to figure out a way to redirect your mind. Breathing exercises, meditations, yoga, again, all great options. Grounding exercises, this would be something like, I can't remember exactly how it goes, but I think it's 5 things you can see, 4 things you can hear, 3 things you can feel, 2 things you can smell, and 1 thing you can taste. It's about just being aware of your senses to get you out and just thinking about something other than the worry that's going on in your mind. It's also like the meditations that we did in class where we were going through and bringing awareness to every part of your body. It's like the same thing, just getting you out of your mind and thinking about something else. Exercising, do anything else, your favorite hobby, watch a show, go on YouTube, read a book, paint a picture, play with your pets, whatever you like to do, just something, anything else to get the worry off of your mind. And talk to a trusted friend. Don't keep this in. Make sure that you talk to somebody that you think will be able to help you. It's not something you should ever have to go through by yourself, and make sure that if you are going through it, you reach out to somebody. When and how to get help: if your anxious thoughts or worries have become severe enough to the point where they're causing you distress and they're disrupting your life, it's important to seek professional help. There's lots of treatments available for anxiety, such as therapy, cognitive behavioral therapy, medications, exposure therapy, depending on your specific type of anxiety. If you have phobias, that's when they may use exposure therapy, or something else depending on your specific anxiety disorder. Don't keep it a secret. Tell somebody. And if a friend is struggling, then make sure you let somebody know too, because that's not something that you should have to deal with by yourself. How to help a loved one: listen to them and make sure to validate their feelings. And that means if somebody comes to you and tells you that they have anxiety, you don't say something like, oh, well, just don't worry about it anymore. You have nothing to worry about. You're so over dramatic, right? Because that's really invalidating. And it's important to let them know that they're being heard and that their feelings are real. It's really what's going on in their brain. Nobody's going to just make this stuff up. And so make sure that you let them know that you understand that they're feeling this way and you're going to help them. Avoid making assumptions that you know what's going to be best for them. Instead, ask them how you can help. What can I do for you? How can I help you? Let them know that you're proud of them, because it takes a lot for people to reach out for help when they're struggling with some sort of mental illness. So letting them know that you're very proud of them for being brave and coming to you is really good for them. Problem solve solutions say, what do you think we can do in order to make you feel better? Can we go talk to your parents? Can we go talk to a counselor? Can we call a helpline? So problem solve with them, see what you can come up with together, and that will be great for the person. Seek professional help and remember to take care of yourself as well. It can be a lot when somebody comes to you and tells you that they're struggling with their mental health, and make sure that you're taking care of your mental health too. And that's why it's important to not keep it a secret. Anxiety summary. This does a really nice job of just going through everything that we talked about and summarizing it really quickly. Anxiety is an important emotion that serves to protect us from harm. Remember, it's that evolutionary adaptive response to a perceived threat, which is important for our survival. For some people, the fight or flight response become activated in situations where there's no real danger present. However, all the physiological responses like the muscle tension, the increased breath rate, the increased heart rate, those remain. These types of situations can vary greatly from person to person. For example, for some people, simply anticipating that they're going to do poorly on a test is enough to activate the fight or flight response. And an anxiety disorder is usually diagnosed when a person cannot function adequately in their daily life due to the frequency and severity of the symptoms of anxiety. That being said, it's not situational. It's not just they have these symptoms of anxiety before a test. It's they have these symptoms of anxiety all the time. That's when it's going to be a disorder and not situational anxiety. It's important to keep in mind, however, that some anxiety is functional, enabling us to get our work done, meet demands of daily life, cross busy streets while being aware of our surroundings. That's just a good way to summarize everything that we mentioned. And one of the main takeaways I hope you get from this is that anxiety is, while sometimes situational anxiety is necessary for our survival, you can always reach out to help for generalized anxiety or the anxiety that is interfering with your everyday life. A statistic that I didn't put on here, but I thought was important to know, 18.1% of the population experiences anxiety. And that's a lot. That's a little bit less than 1 in 5. And that's not to say that, oh, everyone has anxiety, so just don't worry about it. Everybody that has anxiety is legit, and what you're experiencing in your mind is really tough, and it's not something that you should have to experience. And there's always help that's available. It may cause a sense of peace knowing that you're not alone, that a lot of people are experiencing it. But again, that doesn't make what you're going through any less severe or any less valid. It's completely real what you're going through and experiencing, but it's just really important to know and to take away that help is absolutely available. Just make sure that you're reaching out for help if you are experiencing these symptoms. I hope that you're all taking care of yourself. I know this is a weird and stressful time. Make sure to practice those self-care techniques. Maybe if you tried one, try a different one and see how that one makes you feel. And I hope that you all have a wonderful day. And as always, reach out to me with any questions or concerns. And I hope to hear from you all soon.